Deductible, copay, coinsurance, prior authorization. What does all this mean? Today we're going to talk about all the insurance lingo we use when discussing Medicare. Andy Stamus here with Medicare Mindset. A lot of insurance words get thrown around when Medicare is the topic. Let's review some of the most common Medicare insurance lingo so you're well informed and ready to chat Medicare with anyone. Let's break this down into three categories: the parts of Medicare, medical coverage, and prescription drug coverage. Part A is hospital coverage. It covers inpatient care in a hospital, skilled nursing facility care, and hospice care. Part B is medical coverage. It covers medically necessary services and preventive services in an outpatient setting. For example, doctor's visits, medical treatments, lab tests, outpatient surgery, ambulance services, and much more. Remember, Part A and Part B are the only parts you get from the government. The other parts are purchased through insurance companies. Part D is prescription drug coverage. It's an insurance plan that covers medications on a formulary list of drugs, and those drugs must be prescribed by a doctor. Medicare Supplement, or Medigap. This is an insurance plan that helps pay some of the healthcare costs allowed by Original Medicare, but not fully paid by Original Medicare. It works in conjunction with Original Medicare and wherever Medicare is accepted. So if Medicare approves the medical service, then the Medicare Supplement must do its part. But if the medical service is not approved by Medicare, the Medicare Supplement doesn't have to pay anything. Part C, also known as Medicare Advantage. This is an insurance plan that can include Parts A, B, and D combined into one plan. It's typically a PPO or HMO plan with a network of medical providers. Now let's get into medical coverage. Premium. This is the periodic payment made to Medicare or an insurance company to be covered by a medical insurance or prescription drug plan. Deductible. A deductible is the amount you must pay for medical care before Original Medicare or your other insurance begins to pay. Coinsurance. This is the amount you may be required to pay for medical care after you pay your deductible. It's usually a percentage of the cost. Copay. A copay is the amount you may be required to pay as your portion of the medical care you receive. It's usually a set dollar amount. Referral. A referral is the transfer of care for a patient from one medical provider to another. Some Medicare Advantage plans require referrals to see specialists. Medicare Approved Services. This is the list of medical services Medicare will pay a certain portion of when deemed medically necessary. Medicare Approved Amount. This is the amount a medical provider or supplier can be paid when they accept Medicare assignment. Medicare Assignment. Medicare Assignment is an agreement between your medical provider or supplier to be paid directly by Medicare, accept the Medicare approved amount, and not bill beyond the approved amount. Excess charges. This is the excess amount a medical provider can potentially charge beyond the Medicare approved amount. It's only possible when a provider does not have a Medicare assignment contract. Prior authorization. Prior authorization is the process by which an insurance company verifies whether a particular medical service is medically necessary and appropriate for a policyholder. Lastly, we'll finish up with a few terms associated with prescription drug coverage. Formulary. A formulary is an approved list of medications allowed by a Part D plan. If your medication is not on the formulary, you could have to pay the full cost. Quantity limit. This is a restriction on the amount or quantity of a medication that can be purchased during a specific period of time. For example, you might not be able to purchase more than 60 pills every 30 days for a particular drug. Prior authorization. This is just like we mentioned on the medical side, except it refers to a medication. It's the process by which an insurance company verifies whether a particular medication is medically necessary and appropriate for a policyholder. Step therapy. Step therapy is a requirement that a policyholder must try certain formulary medications first before possibly being approved to use another medication. So that means you have to try maybe 1 or 2 medications that ultimately don't work for you in order to get the medication you want approved for use. If you have a decent understanding of these terms, you'll be more confident as you review Medicare insurance options each year. But you don't have to do this alone. Contact us for personalized, no-cost guidance.